Dr. Papaliodis got his bachelor's degree at the TCU, medical degree at University of Texas Southwestern in Dallas. He was valedictorian of his class. He was a resident in ophthalmology at Parkland, and then he was a resident in internal medicine at Mass General. He was a fellow in ocular immunology at Harvard. He's an instructor in ophthalmology at the Massachusetts Eye and Ear Infirmary and Harvard Medical School, director of ocular immunology and uveitis service. He's also instructor in internal medicine at Harvard. He's been listed in the Best Doctors of Boston. There's a resident teaching award from the Eye Foundation there, and he is going to talk about inflammatory eye disease in rheumatology.
I wanted to thank Dr. McLean both for the very nice introduction and also for the invitation to speak here today. When I gave this talk at the Harvard course last fall, I was charged with demonstrating kind of the pathology that we see from the ophthalmologic world when you send patients to us. What is episcleritis? What is uveitis? So the talk really shows images of these entities. So when you get a report back from your referring physicians, you have some semblance of an idea about what the pathology is that we're observing as well. By means of housekeeping, I have no financial interest in any of the products that I will mention in this discussion. By means of introduction, the ocular inflammatory diseases are the third leading cause of blindness worldwide. That's a statistic that really isn't well publicized. I mean, people hear about diabetes and macular degeneration, of course, but it's a significant problem worldwide. And population estimates are difficult to obtain in the U.S., but the NEI estimates that the incidence is approximately 15 per 100,000 in the United States. The male-to-female ratios are approximately equal, but the reason why this disease is so significant is because 35% of patients who develop uveitis will have some type of visual impairment. So although it's not a public health menace by the incidence of the disease, clearly those that are afflicted can have significant visual morbidity as a function of the inflammatory process involving the eye. The age ranges span the entire spectrum of the life cycle, but the most common age is between age 20 and 50. Again, the most productive life point. Given the chronic nature of these diseases, these have become increasingly more expensive to treat. There was a study in Boston looking at HLA-B27-associated uveitis, which from our perspective is a relatively easy disease entity to treat. They purposely didn't look at patients with Behçet's because that would obviously be a more expensive entity to propose treatment for. And the annual cost averaged $4,100 for each of these patients. And when you look at the range, it varied from a single episode of iritis costing them approximately $433, including physician visits and medications, up to as high as $9,600 in a patient who required surgical interventions. So it can really be very expensive. And if you look at the U.S. federal budget in